This is Marcy Nielsen. I'm the CEO of the Patient-Centered Primary Care Collaborative, and I'd like to welcome you all and thank you for joining us today on our Patients, Families, Consumers Open Forum phone call. Our goal for today is going to be to introduce you to our center, its leadership, and also to solicit your feedback about the strategies and objectives that we've identified for this year and in the out years as well. I think many of you know that each of our centers had its own leadership retreat in the month of January, and that's where each of the cabinets defined their goals and objectives. So now we're bringing this information that each of the cabinets weighed in on back to you as the public. And we're very excited to share this information with you, and we're also very eager to hear what you think about it. I'm going to remind everyone that these phone calls, these open forum phone calls, are going to be happening quarterly. They are open to the public, which means we may have press on the phone joining us. And we anticipate that the next round of calls will be scheduled for June. That's going to allow you to see the final plan for all of our centers, and we'll have an outline at that point of deliverables that you can expect to see from this center. Deliverables are going to be things like publications and events, white papers, fact sheets, etc. So without further ado, let's get started because we obviously have a lot to talk about. On slide number 2, you're going to see that today's agenda includes an overview of each of these centers, what we're calling our stakeholder centers, and how they operate within the PCPCC. We're going to have an overview of center communications, and then I'm going to hand this over to our center co-chairs, Christine Bechtel from the National Partnership for Women and Families, and Francis Rienzo from Sanofi. They're going to lead a discussion about the goals and objectives of this center, and then they're going to lead us through a facilitated discussion. That's to gather your feedback and get your guidance, and we are trying to make this as participatory as possible. So let me tell you a little bit before we get started about how we're going to include you in this conversation, how we're going to include the audience. Your feedback from today's discussion is going to be very useful to the staff, to the board, to the other centers. And so we are utilizing technology to its fullest extent to be able to get some feedback from you, and I'm going to explain a little bit about how you can participate. It is going to be really important for those of you who are listening in to be participative because your feedback is going to be critical. We're going to be collecting your feedback. We're going to be asking you to vote on some issues. We're going to be bringing this information back to the center leadership, what we're calling the center cabinets, for their review and consideration. And we're hoping that you'll take all of these polling questions seriously, especially when it comes to ranking the goals and objectives, because, again, we're using this as a town hall setting where we're bouncing ideas off of you and making certain that what the leadership of this center is focused on reflects your needs and concerns. If you're not familiar with this technology, we have folks on the call who can help us. We're going to have polling screens that are going to pop up on your screen, and polling questions, excuse me, that are going to pop up on your screen, and we'll give you a few minutes, moments to cast your vote. We will hold questions until the end of the presentation, but at the end of the presentation, if you have questions, we do want you to participate in one of two ways. One, you can use the raise your hand function that is here on Citrix, or you can type in a question to the chat function, and then the questions will be fielded to the appropriate folks on the phone. So with that, I am going to move you to slide number 3, which begins our formal agenda. So about the centers, I think as most of you on the phone probably know, our stakeholder centers at the PCPCC are critically important to our work. There are 5 of them now. We reorganized and restructured them in the fall of 2012, and they include 5 different centers. You are the Patient, Families, and Consumers Center, but the other centers are the Advocacy and Public Policy Center, the Care Delivery and Integration, the Employer and Purchaser Center, and then the Outcomes and Evaluation Center. The centers themselves are responsible for really being the incubators and drivers of our core activities and programs. So very important in terms of orienting the entire PCPCC. They are set up to achieve the goals that relate to specific audiences and interest areas, as you might imagine, given the description of these centers. And each center is led by what we're calling a leadership cabinet. Somewhere in the range of 10 to 20 individuals. The participation in those cabinets is limited to our executive committee members. I think some of you are familiar with our executive committee structure. Essentially, these are the folks who are the dues-paying segment of our membership. And then on each of the centers, we also have some invited thought leaders to help us identify the gaps in content expertise. These cabinets meet every month to discuss and report on progress as they relate to the strategic objectives which we're going to share with you today. And then for general questions that you might have about these centers, Tara Hacker is our Director of Programs. She's on the phone with us today. She's very easily accessible by email if you have not already met her, and we're going to include her contact information on the last slide, and certainly you can find information on our website. I'm going to move on to slide number 4, and I want to tell you a little bit about how we communicate with each of our centers. So first of all, each center has its own dedicated web page that you can access from our homepage at pcpcc.net. This is shown to you here on the slides. And we are very excited to launch a new website in the next few months that's going to have even more robust content. It's going to include resource libraries dedicated to each center's topic, easy access to meeting materials, etc. So I think we've done a good job reorganizing our website over the course of the last year, but we'll have a brand new website with even more bells and whistles, so stay tuned for that. We know that many of you have been involved with our centers in the past. You're used to receiving a monthly newsletter for the center itself. But starting in this month, we're changing up things to consolidate the information from each center into a single newsletter. That's so that you know, A, what the other centers are doing, which is critically important because there's overlap between the work of the centers, but also so that we're not flooding your inboxes. Many of you sign up for multiple centers, and so this way you'll be getting sort of one-stop shopping. The monthly updates will also include information about our webinars. These are developed and sponsored by each of the centers, and we're planning to offer about 2 webinars a month. You can subscribe to the center monthly update through the center web pages. So again, going back to the home page, then clicking through to each dedicated web page. There on the right-hand side, you can get signed up for each of the center web pages. But I'd also strongly encourage you to sign up through our social media networks to get news from the PCPCC, as we're pretty active on Facebook and on Twitter. So next slide, slide number 5. This slide shows you a bit more about how the centers fit into our larger organizational structure. And you'll see here where the centers live within the bigger, broader PCPCC ecosystem. You'll see here that's the board of directors, the executive committee, which I already spoke of. Those are the dues-paying folks, as well as the task forces and special interest groups. And you'll see here we have listed those 5 centers again. Now moving on to slide number 6. It is my distinct pleasure to introduce our co-chairs of this center. We are very fortunate to have 2 brilliant folks who have been participating as leaders of this center. Christine Bechtel is the Vice President of the National Partnership for Women and Families. Christine has been a partner to the PCPCC since its inception and a tireless advocate for patient engagement throughout her entire career. She is also tons of fun if you haven't gone out with Christine. So I encourage you all to go drinking with Christine. Next, I'd like to introduce Francis Rienzo, who is equally as fun, although he's not gone drinking with me yet. Francis joined our group a couple of years ago. He brings his expertise on cultivating partnerships with advocacy and patient groups, as well as provider and managed care groups. Francis is fabulous to work with and work for, and so without further ado, I'm going to turn this over to Francis.
Great. Hey, thanks, Marcy. I'm blushing already. You're awesome. First of all, everyone on the line, thank you. Christina and I really want to thank you for joining us today. Our goal is that there's going to be a lot of polling, a lot of interactivity. So as a warm-up, we wanted to just start off by getting to know a little bit more about all of you. So if you, I think we're going to have a polling questions interface coming up on your screen. So there's two questions. First is what is your current role in your organization? And I think these are not abbreviated, so these are good. Some of these will be abbreviated, so I'll be reading the full text, but these are all full, so you can read them yourself, I hope. So go ahead and answer. And when we have a good percentage of responses, we'll go on to the next one. Okay, I think we're ready for the next question. Is, so why are you interested in participating in this call and with this center? So to learn more about how to engage. Wait a minute. Yep, there we go. So to learn more about how to engage patients in their own care, have a dialogue with patient and family experts in your field. Are you interested in how patients can be involved in transforming to a patient-centered medical home? Do you want to provide input and direction into how the PCMH is messaged to patients and consumers, or other? All right. It looks like we got our voting in, and now I'm supposed to know what some of the answers were. Here we go. Oh, okay. Sorry, guys. This is my first time doing it. Here we go. So why are you all interested in participating in this call? Looks like interest in patient involvement is the major reason. Want to talk a little bit about messaging? And to learn a little bit more. Great. Super.
Well, this is Christine Bechtel. You guys have come to the right place. So the center that you are, of course, on this phone to hear all about is designed, of course, perfectly to meet your needs, or at least the question options that we gave you. So our center is, you know, in a nutshell, you might say that our center is about making sure that what we call the patient-centered medical home is actually patient-centered, right? So what we want to do is really assure that patients and families are active partners in improving care delivery. So that's a message, obviously, that resonates with a lot of you on the phone. And we want to make sure that patients and families are really viewed as members, core members of the care team. And that's not easy all the time for all practices, particularly given the diversity in size and geographic region and patient populations that span the PCMH modality. And so we want to think about how we can look to the field and share those innovative models and best practices for all of the objectives that I just described. And you'll see on the next slide that we have actually a terrific and very diverse set of stakeholders who share this. Some of you, I think, are probably on the phone today, so thank you. And we have representation in the cabinet leadership from physicians, from the life sciences organizations, from academia, and, of course, from consumers, as well as a number of other individuals. And it's really a great group. We got to sit down face-to-face, as Marcy said, in January together and talk through a set of 4 strategic objectives. And you'll see those on the next slide, on slide 10. And those objectives are, they're big and they're important. And we're going to talk a little bit more about each of them. But the first one is really finding a common definition of patient and family engagement. And the challenge there is that it's kind of like a Rorschach test. So when you hear the words patient and family engagement, many people think they know what it means. But when I ask people to raise their hands and say, are you confident you know what this means, they'll say yes. And keep your hand up if you think that the person next to you would say the same thing. Most people sit on their hands at that point. So we really felt like to drive this field forward, we needed to have a more widespread and common shared definition. So we're going to talk a little bit about that. The second component is, really how you could define the medical home and its value for consumers, for patients and their families, so they know what it is, they know how to look for it, they know what to expect when they get there. The third objective that we have is around developing strategies that actually include, or you might think about this as embedding, patients and families in the evaluation of the patient-centered medical home, and then the concomitant quality improvements initiatives. So, for example, when a medical practice is thinking about how you, do a standard PDSA cycle around some aspect of diabetes care, that they would actually have patient and family partners side by side helping them through that cycle. And then fourth and finally, disseminating resources that address health literacy and cultural competency. And the goal here is reduce health disparities in a medical home context and get people laser focused on reducing and ultimately eliminating health disparities and showing how medical homes across the country have done that. So that's a quick overview. We sat down in January, as Marcy mentioned, at a face-to-face meeting. It was a terrific discussion. But our goal was really to start figuring out, well, how do we operationalize these? And what should we do first? And how should we move forward in the next 12 months so that the PCPCC as an organization can really play a leadership role in these areas very effectively? So on the next slide, you will see on slide 11 that there are some tactics we discussed around this common definition of patient engagement, which we're going to talk more about what that could be in a moment, but we want to get your input on that first. So the tactics, once we have the definition, that we discussed for how we might disseminate that would include things like making sure all of the PCPCC centers understand that definition and what it means at a very real level and how it relates to their work and how their work can reinforce that multifaceted definition. Second, we talked about incorporating patient-centered messaging as really foundational to all of the organization's activities, and as well as really promoting resources that facilitate work in patient and family engagement through the center's webpage. There are many, many partners like the Institute for Patient and Family-Centered Care, March of Dimes, and others who really have done some terrific thinking around these things and have great resources to share, as well as researchers, ARC and others. Next would be incorporating patient engagement criteria into accreditation or recognition standards and really going above and beyond what's there already, and then finally highlighting results and case studies of examples where patients and families have been engaged in meaningful ways, and it's really a model or an exemplar medical home. So those were the tactics we talked about. It's a lot. It's a big bite to take. So Francis is going to ask you to help us prioritize those right now.
So as soon as the polling screen comes up, I'd like you to think about the list of tactics that Christine just reviewed, and which of them do you think should be the #1 priority for the center if we're going to define patient and family caregiver engagement at clinical practice, community, and policy levels? So to review, while you're voting, you can we can share the definition of patient engagement across stakeholder centers. We can incorporate patient-centered messaging as foundational to all PCPCC activities. We can identify and promote partner resources on the center's webpage, incorporate patient engagement and health disparities into accreditation recognition standards, highlight results and case studies of patient, family, caregiver-centered, and engagement. And it looks like we've got sort of 2 winners here as the results are coming in. Let's see if we can get this up on the screen. There we go. So Clearly, the choices that most of you are picking, either incorporating patient-centered messaging into all activities or incorporating patient engagement into the PCMH recognition. So we've got a clear choice in the audience there. Thank you. So then the next question is about how you define patient engagement. Let's see. Let's get the polling question up on the screen, please. No, I think we have to go back one. Yep, there we go. So how do you define patient engagement? Please choose one of these. An individual's knowledge, skill, and confidence for managing his or her own health or in healthcare. Partnership among practitioners, patients, and their families when appropriate to ensure decisions respect patients' wants, needs, preferences. Patients also have education and support needed for decision-making and participation in their own care. Third, patients, families, their representatives, and health professionals working in active partnership at various levels across the healthcare system, clinical, practice, organizational, community, and policy, or the infamous other. So we've got some results in. Keep those votes coming. Keep those votes coming on in. So looks like we've got two major categories here. Active partnership at various levels across the health system seems to be the dominant answer.
Well,
yeah?
That's great news. You guys were paying attention when I spoke. Excellent. We gave away the answer early, so that's good. So I would just say that the first two options are not incorrect. They're just incomplete, right? So they focus on that engagement and care level, and there are more levels than that. And so as you see, the center adopted this idea that it's a real partnership, and that partnership occurs in care, which is patient activation and shared decision-making, things like that, self-management, of course. But that partnership with patients and families also needs to occur at the practice level or the organizational level. For example, in quality improvement and redesign, it needs to occur as well at the policy and the governance level, and community groups need to be involved, particularly at those organizational practice level and the governance and policy level. So you'll see on the next slide, this is a terrific graphical representation of a multidimensional definition for genuine patient and family engagement. This came from the recent Health Affairs article that actually the whole journal this month is focused on patient and family engagement. And this graphic is the overarching kind of framing definitional piece that you can see reflected in it down the left side, direct care, organization, design, and governance, and policy making, and then degrees of engagement. So if you think about, the organization, design, and governance, you could have a beginning and sort of baby, if you will, level of engagement that is about asking patients about their experience of care, and that's it, right? But as you move to greater levels of involvement, another example would be an advisory council of patients, or embedding them in, and having them participate in processes. And then final, really where we're all aiming is this idea of partnership and shared leadership, where patients are actually co-leading safety and quality improvement committees, for example, or initiatives. And then there are some factors that influence that engagement, and some of that does include the activation level. You'll see those at the bottom of this slide, but I think this is very consistent with the center's definition and how we'd like to approach really, creating that broader understanding of what patient and family engagement really is. So our second objective is around the tactics and values that, in developing resources that can define the PCMH and its value for patients and families. And get ready again to think about your priorities here. So we talked about communicating key messages across the centers. We talked about market-based research to test those messages, partnering with organizations to provide tools for patients and providers to deliver those messages. using major media outlets to increase public awareness about medical home and about advanced primary care, and finally, how we can, of course, incorporate patient engagement across all of the education and training task forces activities. So again, can't do all that in the first year. So Francis, you want to facilitate some prioritization?
If we could move on briefly to the next objectives and cycle back to this, that would be helpful for the technology portion.
Yeah, hi, I'm sorry, I was on mute there. I'm sorry, go ahead, what was that?
So we need to, we'll come back to these polling questions, Lauren.
If we could go to Objective 3 and then come back to Objective 2, that would be appreciated. Thank you.
Sure, no problem. So Francis, why don't I do you want me to do a quick overview of 3 and then you can facilitate 2 sets of polling questions?
Yeah, let's do that.
Okay. So our third strategic objective is really about one of the things that you guys on the phone are the most interested in, which is how do you involve, include, embed, engage patients and families in the evaluation and quality improvement process. So this is the question of how do you make sure that the patient-centered medical home really works for patients and families, but at the same time, we're talking about a partnership, right? That's a two-way street. So it's really got to work for practices and clinicians and their teams as well as patients and families. What we know from recent research, also published in a different article in Health Affairs, NCQA fielded a survey that showed that less than a third of patient-centered medical homes today are doing this, are embedding patients in quality improvement and evaluation efforts. So there were 3 strategies we talked about. One is really figuring out the resources that people need to do this work and getting them out there. Probably that would include a set of best practices for how to engage patients and families in QI. And then finally, also asking the Advocacy Center, if we're going to really advance this idea, asking the Advocacy Center to prioritize this idea in their work around shaping accreditation and recognition program criteria so that it becomes no longer optional but a requirement to really show how you're embedding and engaging patients and families. So hopefully the technology is ready, and Francis can take it away.
Here we go. So for the objective that Christine just outlined, what do you believe is the #1 priority the center should focus on to develop strategies to include patients and families in the patient-centered medical home evaluation and quality improvement? So your choices: compile resources, develop processes for wide dissemination, highlight best practices for how patients, families participate in quality improvement efforts, participatory action research, as we say. Third is Advocacy Center to prioritize patient-family engagement within accreditation recognition programs and processes, or other. And we got most of the votes in. Here we go. So I think there's a pretty clear choice there. Highlighting best practices and prioritizing advocacy seem like they're head and shoulders above the rest. And then let's see if we can go on to go back to Objective 2. Apparently I touched the controls when I wasn't supposed to. Let that be a lesson to everyone. So going back a chapter, if you will, if the focus is on developing resources that define the medical home and its value, what do you believe should be the #1 priority for the center? Communicating key messages that resonate with patients, using market-based research to test messages, utilize major media outlets to inform the public about the patient-centered medical home, incorporate patient engagement into education and training, or other. Oh, this one's not even close, folks. We're not even halfway in, but it's clear. Overwhelming majority think we should be incorporating patient engagement into education and training task force activities. Good. Nice to have some clarity. Okay.
Great. Thanks, you guys. So the last strategic objective relates to tactics that we could advance to reduce health disparities. So we've identified 3 primary ones. So first would be evaluating and identifying gaps in the accreditation and recognition standards, particularly as they relate to cultural competency, potentially health literacy. The second is highlighting evidence that shows how medical homes are reducing health disparities today. The third would be presenting to groups and organizations working on cultural competency and health literacy issues about the value of primary care medical homes. And I would include in that as well that we had a lot of discussion about engaging with other centers, because there is not a single center that is part of PCPCC that should not have a role in this objective. So I think it is both reaching outside to engage a potentially newer set of groups or a broader set of groups that haven't historically been involved in PCPCC, but it is also reaching inside the own organization and really aligning around how we can reduce health disparities. So I'll turn to Francis for the polling.
So we have one polling question for you here. Again, what do you believe to be the #1 priority for the center to focus on disseminating resources that address health literacy and cultural competency? Should we be evaluating and identifying gaps in accreditation recognition standards for cultural competency and health literacy? Or #2, should we be highlighting evidence demonstrating how medical homes reduce health disparities? Or #3, should we be presenting to groups and organizations working on cultural competency and health literacy issues about the value of primary care medical homes, or other? Okay, so looks like the first 2, particularly with highlighting the evidence and identifying the gaps, are ones that make the most sense to our audience. Okay. So now we want to go on to, we want to take a look at the tactics that you identified as #1 from each of the previous objectives, right? So I think the team is scurrying to get those all up in one polling question. And as soon as we do, what we're going to do is we're going to ask you to prioritize all the #1s from all of the different objectives. So here we go, right? Please select the one that you think is most important. Now keep in mind, one of these corresponds to each of the objectives that we talked about and that were developed during the planning retreat. Votes are still coming in. Let's let them keep coming in, because this is interesting. It's pretty close. About a third, a third, a third. Almost.
It's like picking among your children.
Yeah, right, exactly. Exactly. So then...
Or your cats.
Right.
Oh, yeah.
So then I think the question to open this up for some discussion perhaps is, are we missing some objectives or tactical approaches to meeting the center's goals?
So does somebody want to give instruction on how people can unmute themselves?
So if you'd like to contribute to the conversation, the way that we do it with this system is that you can virtually raise your hand. And so if you do that, Francis will call your name and we will unmute you on your phone line so that you can contribute to the conversation.
I'm not seeing any hands being raised on my dashboard here.
We have one from Lauren.
Oh yeah, here we go.
Lauren.
See here.
Family Voices, New Jersey. The only other thing that I would suggest would be more of an action, as an advocate, more of an action alert type of thing, and including the objectives of the patient-centered care in all of your testimony, which is what I do. I put your organization and the website links in a lot of my testimony on the medical home and those kinds of things. So I would like to see more of that.
Thank you.
You can also, if you'd like to make your comment via a question written in the question box, we can read those questions out for the audience as well.
I'd also be interested in what people perceive. I know we have some actual medical home practice representatives and also individuals who work with them. So if we could also invite you to share with us what you perceive some of the central barriers to patient and family engagement really are, and to be specific about the kind of engagement you're talking about, care level or quality improvement and redesign or policy, those, governance, things like that. I would really invite you to do that so that we make sure we're looking at our strategic objectives through the lens of removing some of those barriers so we can really advance these important practices on a broader scale.
We have a question from Tiffany Noel Brown, who says, are we capturing what patients, community members, are doing around engagement in their health, not just their health care?
I think that's a very important question. This is Christine, and Francis, I'm sure you have thoughts too. It is the right question because it is critically important to start to rethink the way that we view patients through the lens of a very institution-based system where we are sort of asking them to jam that their life really into that system as opposed to fitting healthcare into their life, right, which are two different approaches. And I think that's part of what that question is raising. And I think it's a very valid question. And it's always a challenge because there's an intersection here between something that really is in many ways an institution today, which is the patient-centered medical home, a primary care practice, and then, of course, the patient who, if you think through the precepts of what genuinely patient and family-centered care is, it starts with having a whole person orientation. So I think it's a question that we should take back to the center's leadership and talk through and look at these tactics through that lens. Great point. Francis or staff, I don't know if you guys have reactions as well.
Yeah, I also think if you take the patient-centered medical home to its logical extreme, you're going to see patients being engaged in their own health. You're going to see a need to extend the medical home to non-medical services. How do you exercise? How do you get the food that you need? How do you get to where you need to go to be healthier? How do you pay for those things? Community-based resources that can help with a lot of those challenges. They will be important for the patient-centered medical home to succeed. So I think it's a big yes. I think maybe we need to think a little bit more about what are the mechanics of capturing those things and putting those best practices forward. But it's certainly a good area to focus on.
And I think I would add to that as I'm listening to you, Francis, the thought that occurred to me is I think there's a difference between patient and family engagement, which is a strategy, and patient and family-centered care, which is a goal that would encompass all of those important attributes you just described around connecting to community resources and supports and really getting beyond a medical model. And I think the center needs to think through what it's about this year. Is it about driving forward patient and family engagement as a strategy for hopefully achieving patient and family-centered care, or is it about both? And we need to add some tactics around helping people understand what does patient and family-centered care really mean, in addition to how patient and family engagement, both in their care but also in practice redesign, could help us get there faster and more appropriately, I would say, or more effectively. So great question, and thank you for that.
Do we have any additional either questions in writing or hands up?
We have a couple of comments in the questions, Francis. I'm not sure if you can see them, from Audrey and Sarah.
I cannot, so could you go ahead and read them?
Sure. Sarah Ball says that she agrees on focusing on social determinants and how to best engage the community as the best way to engage the community. And then Audrey Wetzel says, need to re-engineer training programs that healthcare providers receive around how to support and communicate patient-centered care, especially clinical support team members. Those are the two comments so far.
Yeah, so I mean, that's an issue that came up at the retreat, that last one, certainly many, many times, of do patients know they're in a patient-centered medical home always, and how is that communicated to them by the folks that are working with them? I mean, that's an area that we certainly are aware of. Christine, any comment about the social determinants part?
Yeah, I mean, I think it actually takes me back to this idea of, do you focus on care or do you focus on strategy? Because if you want to drive improved health outcomes, you have to focus on social determinants, period, end of story. But at the same time, the ways in which that happens from a workflow and a care process engineering standpoint can differ. And so then I start thinking, well, yeah, but if you engage patients and families in particular projects, looking at how to engineer not only the practice's workflow, but the patient and family members' workflow around how they provide information related to social determinants, how they engage with resources to address them and things like that, which again gets to patient-family engagement as a strategy. So I think, again, great comments, and I think we should also understand where some of the other centers within PCPCC are with respect to this, and with respect to addressing the training issue that was also raised in the comment box.
Okay. All right. Do we have any more comments, questions, either verbal or written?
Francis and Christine, this is Amy from the PCPCC. I was thinking it might also be a good time to ask people who are participating, knowing that everyone's prioritized education and training and the incorporation of patient engagement and patients being part of education and training programs. One of the things that we're doing, if not everyone on the call is already aware, is we are working on collecting best practices and an innovative curriculum that's doing just that, and curriculum across disciplines. So whether it's for nursing, social work, medical, across all those programs, and especially interdisciplinary training programs. If any of you on the call are aware of places where that's being done really well, I'd encourage you to go onto our website and submit those curriculum, because we really would also like to highlight those curriculum that have really actively involved patients and families in the training of professionals as well.
And Amy, I would say the same applies if you know examples of best practices around involving consumers in quality improvement. That's another priority that the group identified. And so there are some example practices out there doing some great work, but we've got to find them and catalog them. So input is welcome on that front as well.
Absolutely. And anyone on the call who knows of some of these best practices or examples that you would be willing to share with us, you can email those to myself or to Tara, and our information's on the website, and they'll be on this webcast as well.
Okay. All right. Well, I think it sounds like we're perhaps ready to wrap up. If we could go to slide 21. And first of all, a thank you for your participation. Thank you for bearing with us as we get the mechanics figured out. I think it'll be smoother next time, and I think we'll also come up with a really good way to have some interactive dialogue at the end. We'd ask if you would please just take a couple of minutes to fill out the very, very short post-webinar survey. There's, I think, 7 questions. We'll use that information from you to shape future calls to make them as entertaining and informative as possible. And, of course, you can always contact Tara Hacker, the PCPCC Director of Programs, if you have any questions, feedback, compliments about the hosts. It's all welcome. Her contact information is right there on the screen. So again, thank you, everyone.
And thank you, Francis and Christine, for facilitating a great dialogue today. Thank you, everyone, for tuning in, and look forward to having you join us again in June for our next town hall meeting. Take care, everybody. Thank you.